Let's kick off this very interesting meeting. It's a webinar on the day of Opioid Painkiller Addiction Awareness Day. I'm being joined by my wonderful host, wonderful guest, Cathryn Kemp, who will be introducing herself in a minute. But this webinar will be talking about painkiller addiction, and someone's journey into it. There'll be a number of aspects that we'll be touching on one by one, and hopefully as we go along, we'll be discussing various sensitive and as well as very interesting aspects of what painkiller addiction looks like. Before I move on to introduce my guest, I'd like to introduce myself. My name is Yasir Abbasi. I'm a consultant psychiatrist and an addiction specialist. I'm currently based and working with Maudsley Health, which is based in Dubai, United Arab Emirates. And we're working with the addictions department over here. Painkiller addiction affects a number of people, and it affects almost everywhere in the world. We met, I think Cathryn Kemp and I met, I can't remember, I think almost 7 years ago via...
2013, yeah.
Right, okay, wow. And that was through Twitter, I think. And then we scheduled a phone call, and as they say, the rest is history. We set up a charity called Charity, which stands for Painkiller Addiction Information Network, almost 6 years ago, 5 to 6 years ago, which is involved in increasing awareness around painkiller addiction. We've done lots and lots of good work. Again, when we've set it up, we've never looked back. And this webinar is part of a series of increasing awareness, really. And we're increasing awareness about opiate painkiller addiction. This is supported by Pain Charity, which is a UK-based charity, and also by Maudsley Health, which has its link to South London and Maudsley NHS Trust. Maudsley Health is based here in Dubai, the UAE. Right, so would Cathryn Kemp introduce herself before I start asking you lots and lots of questions, Cathryn?
We've only got half an hour, Yasir. It might be worth muting everyone, because I think people are coming in and it's unmuted. So I don't know if people can actually do that individually or whether you can do it from there.
I'm trying to mute as they join in.
Okay. Yeah, so my name's Cathryn Kemp, and I'm the author of a book called Coming Clean. I've got a copy right here, which charts my journey through major illness and a major addiction to the prescription drugs that I was given. Namely, well, you'll hear my story, but it ended up with fentanyl. I basically got thrown into rehab 2 years after leaving hospital. I've been in for 4 years, and I left with a repeat prescription for fentanyl lozenges. And at that point, 2 years later, I was in rehab and thinking, my goodness, how on earth did I get here? And went through the most transformative experience and came out, as you do, wrote a book, got it published, and then met Yasir. And together, actually, you know, we've been having this conversation for 7 years, as Yasir has said, and we decided to take this in. And this was a conversation that really wasn't being heard around the world. You know, we weren't seeing much about painkiller addiction, but, you know, Yasir had patients. I saw people coming through the whole recovery system that were going through the same kind of thing that I did. And we decided to talk about this on an international level. So we've been talking about this on press all over the world, with media, TV, radio, and, you know, and it is a subject that's out there now. And, you know, we've done a lot of work around this area. We've talked to people at the House of Lords, and we've lobbied government, and we've talked to Public Health England. Yeah, so that's me.
Yeah. Yes, thank you very much. And Cathryn actually is being modest, she's not mentioning that she's been a best-selling author as well. And she's ghostwritten a number of books, and we can find more details about that on her website. So thank you very much for that introduction, Cathryn. And yes, we've represented about painkiller addiction in the House of Lords in the UK, and we've visited the British Parliament as well as Public Health England. We've been part of the review as well. But I guess, Cathryn, let's start off by talking about you, really. Let's start talking about you as an individual. How would you describe your life before this? I mean, I'll call it an illness, but how would you describe your life before this illness? I would like to know how you were generally dealing and working.
Yeah, so I was just kind of, I'd been to school, I'd been to university. I started working in newspapers. I was a writer, and I was, working my way up, and I ended up on national newspapers and working for the Mirror Group. And about a year before I fell ill, I'd set up my own press agency. So I was living in London. I had a team of photographers. I was working on news and magazine articles for, across the spectrum of the British press. And, there was a real velocity to my life. Things were moving. And then literally in 2004, I was literally hit overnight. Well, it wasn't even overnight, actually. 2 hours before I got the first indication that I was ill, I'd been out on a story with my photographer, and literally 2 hours later, I was in A&E, very seriously ill. I'd had this sudden onset of acute on chronic pancreatitis. And I don't know if anybody out there has experienced pancreatitis, but it is known as one of the most painful things you can experience. I mean, it is on the NHS sort of Richter scale for pain. I think it's above childbirth. It's, it's serious stuff. And the surgeons kept saying, we lose people, we do lose people with this. And, that as soon as it was diagnosed, it took a while to get diagnosed. As soon as it was diagnosed, the whole sort of energy around the illness shifted. It was literally, I was straight onto a morphine drip, straight onto a saline drip, nil by mouth, in a hospital bed. And I'd literally gone within a couple of weeks from someone who was just living their life in the way that we live our lives and trying to build a career and out with friends and doing a lot of travel, to someone completely debilitated with a life-threatening illness, in enormous pain and in enormous denial about it, because I was still, the first couple of weeks I had all the drips coming out of my arms, and I was still tapping away on my laptop trying to file stories to the Mirror. It was just this really surreal experience. My head just would not give up the fact that everything had changed. My health had gone and everything went as a result.
Wow. So again, a very busy individual working through the daily chores of life, really, and then suddenly hit by an illness, which then kind of changes things to some extent, but without you truly realizing the impact of it. And then you were prescribed painkillers. You were prescribed painkillers for a genuine, what we call organic pathology. So there's an underlying problem, an illness, and you need painkillers for that, which naturally is always the case. Tell us how you then kind of moved on from someone who's trying to deal with pain with painkillers to someone who's struggling to manage the painkillers itself.
Oh, okay. So I was in and out of hospital for the next 4 years. The whole time I was on either IV morphine in hospital or oxycodone, like a morphine derivative, for the times that I was able to be out of hospital, though it was never very long. I was on 2-hourly pethidine as well, which of course is an opioid. And I was also prescribed tramadol. And in fact, actually between doses in hospitals, and this is something I get really, really kind of cross about, and I really hope that this has changed. But I was experiencing what I now know to be withdrawal symptoms in between doses of pethidine and morphine, and severe muscle aches, sort of almost like hallucinations, racked with pain. And I was actually prescribed more tramadol to deal with that in hospital. So there was this kind of blindness to the effects of opioids on patients. And I had no idea what I was taking, absolutely no idea. And I didn't look into it either. I didn't care. I wanted the pain to go away because this was something that I felt was unlivable with. So this kind of dance carried on. And by this stage, my dad, who's listening today, and amazing that he's here, because my mum and my dad got me through. They literally, I was bedbound at their house. They were having to do everything for me in the times that I wasn't in hospital. It was a weekly occurrence to have to be taken back into A&E with another bout of acute pancreatitis. It went on, and in the end, I had to really fight to get up to a London hospital that was a specialist hospital in pancreatic sort of conditions. And they did a test on me, and they discovered I was suffering from quite a rare condition known as sphincter of Oddi dysfunction, which is why no one had kind of tested for it before I got there. At that point, the morphine was switched straight over to fentanyl. And, you know, these drugs saved my life. You know, I can't emphasize that enough. This is not an opioid painkiller bashing. This is, you know, how do we deal with people who are out of hospital with chronic pain, living with opioids? That's what we're sort of looking at. But at this time, it was entirely appropriate, as you've said, to have an acute condition and be treated with very, very potent opioids like fentanyl and morphine. They saved my life. So eventually, at the start of 2008, I was discharged and I was sent home from hospital with a repeat prescription for fentanyl lozenges. I don't know if it's worth you just sort of explaining what they are.
I think it would be very important for those who are listening, because we have a wide variety of audience here. So when people are in pain, they are prescribed painkillers, and there are a variety of painkillers out there. Some are as simple as acetaminophen, which is also known as commonly as paracetamol. The others are known as NSAIDs, or non-steroidal anti-inflammatory, like ibuprofen, and there's diclofenac and other tablets like that. And then there's another type of painkillers known as opioid painkillers. Even the opioid painkillers, well, there are other types as well, but we're not going to give a long lecture on that. But the opioid painkillers themselves are different types. So you've got weak and strong opioids. I'm pretty sure those in the UK would have heard of cocodamol. So cocodamol would have codeine and paracetamol in it. So codeine is an opioid painkiller, and paracetamol is a generic painkiller. So they combine that together. And as you go up the ladder of strong painkillers, so you go on from codeine, dihydrocodeine to tramadol, which is moderate, and then you go on to oxycodone, and morphine and fentanyl. Morphine is almost similar to heroin, really. So heroin is called as diamorphine. So it's as strong as that. And fentanyl apparently is stronger than heroin. So it's a very, very strong pain.
50 to 100 times stronger. Yeah.
Absolutely. It's used quite regularly, sometimes in the battlefield as well, to give immediate pain relief to those who sustain injury. So they have various forms. So you've got these patches, but I think Cathryn was given what we call oral transdermal fentanyl. So they're literally like like lollipops. I don't know whether they're sugar coated.
And they taste like lollipops. They kind of taste.
They are sugar coated.
Yeah.
You know, I remember when I was in Leeds doing a clinic, a patient came to me, and she complained of losing her teeth to these fentanyl lollipops because they were so sweet, and her oral hygiene just went downhill from there on. So yeah, they are like lollipops. So you were on these really serious, heavy pain relief medication, repeated bouts of pancreatitis, trying to balance and juggle a very difficult and naturally busy life. Was there a moment where you realized
that there was no? I mean, I was completely debilitated. I couldn't do anything
by that time? So all your movement came to a standstill almost. So was there a point where you yourself realized, you know what, I think there seems to be some issue here. There is a problem.
So yeah, I mean, I look back now, and I left hospital addicted to you know, basically heroin. I didn't know that at the time, and I was sent home with, as you say, these lollipops, and I was told to have 8 a day for breakthrough pain, which is pain that comes through the, because I was also taking like wearing a patch, like the highest patch that you could get that put fentanyl into my bloodstream. And so the lollipops are only meant to be for pain that broke through that sort of continual patch. And it took a couple of months of that before I started taking another one, or maybe it was even less actually. And everything kind of, my life had obviously completely imploded because of the illness, but I had managed to have a relationship, and I was with my boyfriend. I don't really know how that was even possible, but at some point after that, I think it was about 2 months after I came out of hospital, he left. And it was that day that I took an extra lozenge, because I something to do with the emotional pain and the physical pain and the cravings that I was now experiencing on a minute by minute basis. It all kind of came together, and I thought, do you know what, I'm going to take an extra one. I'm going to tell the GP that I had a really bad pain day, and I'm going to take an extra one. And I thought, in a funny way, I thought I was getting control of my life back. And actually, it was the point that I totally lost control. And within a week of that, I was on sort of 11, 12 a day. And then within a couple of weeks, I was on 15 a day. And it took about 4 months to get to the point of realizing, of my doctor realizing, actually, my GP realized, because obviously all of this was on prescription from my GP, where he said, actually, I think you're addicted to I think you're a drug addict, was actually what he said. And I was like, of course I'm not a drug addict. I'm middle class. I can't possibly be a drug addict. I mean, completely crazy. And, that's sort of when the denial started. So he already knew. And every time I went into the surgery to see him, we sort of did this kind of dance where I would say, I'm on 15 a day now, and he would draw up a chart, and we would try to cut down. I cut down by maybe 1 lozenge a week. And then as soon as it got to the point where, the pain was too much to live with, then I bounced back again to the higher amount. And we were sort of doing this dance over months. And he kept telling me that I was, that it was beyond a level of sort of dependence, that it was actually addiction now. But I had this total justification for staying on this medication. I was in pain, and I couldn't see how I could possibly live my life without these drugs. And I don't mean to be funny, but nothing has changed pain-wise between that point then and now. It's just that now, without the painkillers, I have to live with it and manage it. But now my endorphins are working again in my body. It's at that point, the endorphins had just gone on holiday. That I was very debilitated, but I had this brilliant excuse for staying on, and I was terrified of letting go of those painkillers.
It was very interesting, Cathryn. Can I just ask you again? In the beginning, you mentioned you took that tablet, that extra tablet, at a point where you thought it might help you for a reason other than pain.
Yeah. I think so.
Thinking back, and you're reflecting back, and that spiraled into a kind of a storm of things becoming more and more complex, challenging, and worse for you. But you also then mentioned, in terms of pain, things haven't changed a huge amount. So the pain you experienced when you were addicted to these painkillers to what you experience now, but yet your perception and your reaction to that have changed.
Yeah, completely. And they had to, because I basically, when I had to, in the end, when I had to face up to the fact that I was going to die, actually not from the illness, but from my addiction to the fentanyl lozenges, at the point when I was on about 50 of them a day, it was at that point that it was like, well, I have to face the pain or I'm dead. I mean, there was no other choice. And, I knew that I was between a rock and a hard place, and I was writing notes and putting them under my pillow because my mum was caring for me. And I was leaving notes under there in case she came in and found me, overdosed in bed.
Okay.
And so I knew I was going to die. And when I finally got into treatment, I mean, I got refused NHS treatment, and I didn't realize you could walk into a hospital and just say, please detox me. I mean, I don't know if that's the case everywhere, but there was certainly that would have been available. We didn't realize that. So in the end, I went to a private rehab. And when I got in there, they said, well, you've got less than 3 months left to live, if that. And they really didn't want to take me because the risk of me ODing, because that first week in rehab, when they had to supply the lozenges, it was 60 a day that I was starting the detox from.
You very nicely in your book, and you're very eloquent in your book describing your journey, and you go into quite a lot of details in a number of things. But you also describe a moment where you kind of had this big black bin bag with lots of medication in it. Describe to us at what point you actually saw, you kind of felt and said, this is it. I have to change. And I know it doesn't have to be one singular moment, naturally over a period of time, as you described, you thought, well, I will end up dying.
Yeah, I mean, there was mounting evidence to show that I was going to die. As you say, that I was being prescribed 180, no, actually, in the end, it was 240 lozenges, which is however many boxes, and they're quite big. So to have to take a black bin liner to the pharmacist and carry them back in a bin liner. Yeah, even that though, I mean, it took, my denial was so strong that it really took until I was in rehab. I mean, I accepted that I had to go to rehab because I couldn't see another way to do it, because I knew I was going to die. I still didn't want to come off the painkillers. I wanted to be reduced down to an acceptable level, because I really, really didn't know that I could live without them. I mean, that was, genuine. I didn't actually want to come off them completely. I kind of knew I was going to die, but even so, I still needed the drug.
Yeah.
It's really hard to describe if you haven't been in that situation, but it took about a week in rehab listening to other people talking about, their experiences, that I was like, my God, I'm in real trouble here and I have to get off them, and this is my only chance.
Yes. Okay. Wow. People are asking more about naturally your journey and how to get access to your book. I've pasted a link in the chat, so if you go have a look at the link, link on the Amazon. I've also pasted a link to our charity. So here you go. Just coming.
Thank you.
If you want to read more about Cathryn's journey. People are also asking questions as we go along, and please do ask questions as you go along, and I'll ask Cathryn them. So one of the questions is, are you completely pain-free now? And an attached question to that is related to some sort of treatment, whether you advise someone to go to rehab, directly coming up from 300 milligrams of tramadol. And again, we can't give individual clinical advice here.
Yeah, I wouldn't really know. I mean, that would have to be something, ironically, that you discuss with your GP, and they can, put you over to, hopefully there'll be pain services or addiction services in your area. And it is so localized, so it's really, really hard to give anyone any advice, because there isn't, a standardized sort of system in the UK, which is something that we also campaign about with charity, that there really needs to be. So I can't, but I'm not completely pain-free, and I get very tired, and it affects my moods as well. And some days are better than others, but I'm alive, and that was the deal. It was like, I have to actually meet the pain. I have to live with the pain. I have to accept it. So that it's a big mental shift, and that was the only choice available to me. So thank you for asking the question.
You again very nicely explain how, and I've seen this with a number of patients that have come to the clinics that I've worked in, is they are on painkillers, and when they try to come off themselves, they start experiencing very typical opioid withdrawal symptoms. And these opioid withdrawal symptoms are very similar to how people would experience withdrawal symptoms coming off from heroin. The intensity might vary, but they're somewhat similar. And one of the symptoms is a generalized body ache and joint pains. So the patients would try to come off it, but then they thought their pain was getting worse, even though they were experiencing withdrawal symptoms. And they're out of fear, they'll restart the pain medication, or they'll start increasing the dose, thinking that they're becoming unwell. So I guess, would it be right to say there's an element of education that we need to do amongst the general public and healthcare professionals, so they all work together?
Yes, is the answer to that. Oh my goodness. I mean, I don't know if anyone else has the same kind of experience, but certainly even when I was seeing my GP, there was no real explanation about what these drugs were, what effect they have, the risk of addiction. We don't, that was never discussed. And similarly, I didn't do any of this research either. I didn't care what I was taking as long as it took the pain away. So, there's a contract on both sides, isn't there, that we actually have agency as patients, and we need to exercise that agency, that it's our choice to take the drugs we're prescribed. I think gone are the days where the doctor is this kind of God, sorry, Yasir, and that what they say
I
is
need to end the webinar now. Carry on.
Yeah. No, that's where I got to. Yeah. So I think that we all have a responsibility to look at what we're taking, And we do need NHS England to step in here and say, this is what you're taking, these are the possible effects, even sign a contract between doctor and patient. That's something we've talked about with the charity that we've campaigned for, so that we're all really clear about this. And obviously provide pain and addiction services in each and every area. I mean, it's a no-brainer, right?
Absolutely, it is. And we've kind of campaigned that with Public Health England. We've campaigned that in the Parliament as well. And I'm acutely aware that we have a wider global audience within our webinar, and people from different parts of the world are also attending. So we've kind of talked about localized services as well. But generally, overall, what we'd like to kind of tell our global audience is that it's important to be able to recognize this as a problem by both health professionals and the patients themselves, but also be able to have an integrated service which has primary care, pain specialists, and addiction specialists working together to help the recovery journey. And it's not easy. So if I put a time frame, Cathryn, so let's say the moment you realize, bang, that's it, I think I need help, to the point that you were completely off these opioid painkillers, what was the time frame like?
It was probably relatively small. It was a matter of months as opposed to years, because even though I was doing crazy things like hiding lozenges in the beams of my cottage, or in in sort of secret areas in the bathroom, or even though I knew I was behaving in a way that wasn't healthy towards my painkillers, I still wouldn't admit to myself that I had a problem with painkillers. I still thought I had a problem with pain. So it's a really difficult question to answer, but from the point at which I was writing the suicide notes and I knew I was done, I knew it was over, and actually, do you know what? It was probably from the point that my doctor cut me off, because actually he called me into the office and said, it's been 2 years, you're on 55 fentanyl lozenges a day at that point, all on prescription, you're going to die, and we can't do this anymore. So he actually cut me off. He actually said, this is for 1 more week, we're going to prescribe this and we'll never prescribe you another opioid ever again. Now at that point, I could possibly have gone out and bought heroin, or I'd have to have bought an awful lot of heroin, I think, but there could have been other ways of doing it. But thankfully, the first thing I did was go home, Google rehab, and book in. And so really at that point, by the time I was absolutely free, it was about 3 months. But it can be quicker, if you have the realization, and you can get access to support. And obviously support, as we've said, is different all over the world. So, but if you can get access to support, it can actually be something that happens within weeks, in theory.
I guess to also emphasize the fact that it can be quicker, and it can be slow as well. For some people, it might take weeks, months, sometimes longer, because the availability of resources and their interaction with the health services might play a role. So not to lose heart if you're not coming off them within weeks or months, as long as your trajectory, your journey is in the right direction. That is, you are aware that the opiate painkillers are a problem, and you are reducing them with a view that you want to stop them. So you're going in the right direction.
Can I just say that I still get loads of people contacting me on social media, or via my literary agent, and there's a lot of women who are experiencing this, and this is people from all over the world. It isn't just UK based, and very often they're holding together, families, relationships, elderly parents, jobs, and actually the whole idea about kind of leaving all that to go into rehab to get clean or to come off them, it's just not going to work. There's no context for that in their life. So it's really important to establish that kind of honest connection and support with the GP that's prescribing this stuff, because for many of us, that's the only way that we can do it. It's not always possible just to go off for 2 or 3 months to rehab. At the time I was single, didn't have children. Yeah.
Absolutely, I agree. And sometimes it's not easy for everyone to just check into a rehab, but again, it can be done depending on the complexity of your painkiller addiction and your pain itself. It can be done in collaboration with your doctor based in the community, or you might need to be admitted to a rehab or a detoxification service.
And there's the substance misuse services as well in the UK.
Yes.
That I would imagine that's a main point of contact.
Absolutely, and they vary from area to area. So just see, some areas are provided by NHS, other areas are provided by the non-NHS providers. Before we move on, would you like to kind of just give us a brief about your book, Coming Clean? I know you kind of talked about it right at the beginning, but tell us a bit more about your book.
Yeah, so during the illness, I mean, so I was a journalist, obviously, before this all happened. So, you know, I process everything through writing. And so during the illness, and it was literally all I could do. So I wrote diaries. And then when I went into rehab, I carried on with those diaries. And so by the end of that whole experience, and when I went into recovery and came out of rehab, you know, free of the painkillers, though in an absolutely horrific state. I mean, you know, it wasn't pretty, but I was free and I was clean. So I got 22 diaries from that whole experience. So I think it was really part of coming to terms with what had happened, because it was such an extreme situation, and I knew that my situation had been extreme. And so I started to write the whole thing, and it sort of just became a book. And it was at that point that I wasn't working then. I was still very ill. So the only thing I could do is lie in bed with my laptop and write something. And I also noticed that I was going to recovery groups, which I still go to, and I was meeting other women and other people who were just as confused as I was about who out there was talking about this subject. And I realized that nobody was talking about it. And then I kind of realized that perhaps that was something that I had to do, because I had all of this information, I had all of this, sort of all of these resources. So I bought a copy of the Writers and Artists Yearbook, you know, picked out a couple of agents from that, wrote them both, sent off the manuscript, and luckily one of them took me on. And it was bought by Little Brown, which is their imprint Piatkus, and it came out originally in 2012. And that's when I started talking about it and doing that, and that's when we connected and started setting up the charity. And then it was republished in 2017 with a new foreword, a new cover, new branding, and the same resources at the back. Because this is a thing that, you know, I'm acutely aware that I was extremely lucky to have parents who were able to fund rehab for me, and I'm really angry for everybody else in the whole world who doesn't have access to that resource. And so, you know, anything that I write or do has got to have resources for people, that we share, and that we spread information, and that we find some way to help other people who are going through what I went through.
Great. And I still remember in 2015 when we did that big conference in London, and both you and I spoke there, and we had this remarkable response from the attendees, all of whom were health professionals, who I wouldn't say they were surprised, but they were taken aback by your journey, and a lot of them still keep in touch, kind of highlighting how the prescribing habits changed after listening.
Oh, wow.
Yeah. So again, brilliant stuff going on there.
Amazing.
So we're almost coming to an end to this lovely discussion we're having. So in the end, just in a minute or so, Cathryn, what kind of advice would you give to people who think that they might be addicted to these painkillers, as well as health professionals? What kind of final advice would you like to give them?
Okay, so yeah, for patients, it's you know, the point of contact is your GP, wherever you are, and to get the ball rolling, and to just be very honest about your struggles, and to really just, because it's the only way that you could, you know, your quality of life, or even your life, might be at stake, and that's just really, really important. And then obviously it depends where you are as to what services you can access. And in terms of healthcare professionals, well, we just really want to see pain and addiction services working together really closely. And I know that, you know, that this is something that healthcare professionals are really aware of and really wanting to do. And it always seems to come back to that word funding, you know, wherever you are, is there going to be money for this? And it's also just to acknowledge that that recovery is possible from this, that people can be in the kind of pain that I was in and continue to be in, and have a quality of life without painkillers, that it is possible, even though it really, really looks like it isn't.
That's a very strong message. Again, the fact that life exists beyond painkillers for those who are on painkillers.
It can do. And it's also not to say that we just take away painkillers from people as a matter of course. This isn't about opioid bashing at all. They have a really important part to play in modern medicine, and they saved my life when it was about the acute situation. It's just about whether we know they don't work for chronic pain. We know they don't. So we have to find ways to live without them.
Okay, and again, people are talking as we go along. We don't have a lot of time, but there's someone who's mentioned in the chat that they're very keen to explore the use of technology,
Yes.
potential as a digital biomarker, digital therapeutics, and remote patient monitoring. And there's been some work around that, and particularly around using mindfulness within a virtual reality kind of setting to deal with pain. There's a lot of evidence around using cognitive behavioral therapy, which is a psychotherapy, not medication, for chronic pain, particularly when the pain goes beyond 3 months and it is not something which is life-threatening or is cancer-related. Then the role of medication slowly and gradually does reduce. So these are all things that we need to explore, but unfortunately, like all good things, this webinar has to come to an end. It's been lovely talking to you, Cathryn, and thank you everyone for attending it. Thank you very much, Cathryn, for being here and giving us your time.
Thank you so much, Yasir. Thanks to everyone who's taken the time to listen and just be part of this conversation. It's a really important one.
Absolutely, absolutely. And thank you for all those asking questions and being here. We will hopefully try and set up more webinars to on similar topics. Thank you very much and goodbye. Have a good day.